Today, we are going to talk about bipolar disorders. What is a bipolar disorder? Bipolar disorder, also known as manic depressive illness, is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day to day tasks. The manic phase, or known as bipolar disorder, is something that we should talk about, discuss, and understand. Why? Because over 10 million of Americans are living with bipolar disorder. Somehow, you will have to deal with a person with bipolar disorder. Having knowledge about it would make your life easier. You would now understand why they are acting the way they are. You will be more compassionate towards them, and you will know how to deal with them. Awareness is the key. Bipolar disorder can look very different in different people. The symptoms vary widely in their pattern, severity, and frequency. There are four types of mood episodes in bipolar disorder. The first one is mania, the second one is hypomania, depression, and mixed episodes. What are the psychological symptoms of bipolar disorder? Psychosis can occur with bipolar disorder. The person's thinking becomes disconnected or dissociated with reality. A psychotic episode can involve hallucinations, delusions, confusions, and disturbed thoughts, a lack of insight and self awareness. Bipolar psychosis happens when a person experiences an episode of severe mania or depression, along with psychotic symptoms and hallucinations. The symptoms tend to match a person's mood during a manic phase. They may believe they have special powers. This type of psychosis can lead to reckless or dangerous behavior. If bipolar psychosis occurs during a low period or depressive episode, the individual may believe that someone is trying to harm them or that they may themselves have done something wrong. This belief can trigger feelings of extreme anger, sadness, or fears in the person. Both a manic and hypomanic episode include three or more of these symptoms: abnormally upbeat or jumpy or wired, increased activity, energy or agitation, exaggerated sense of well being and self confidence, decreased need for sleep, unusual talkativeness, racing thoughts, distractibility, and poor decision making. A major depressive episode includes symptoms that are severe enough to cause noticeable difficulty in the day to day activities such as work, school, social activities, or relationships. An episode includes five or more of these symptoms: depressed mood, marked loss of interest or feeling no pleasure in all or almost all activities, significant weight loss, insomnia or sleeping too much, either restlessness or slowed behavior, fatigue, feelings of worthlessness, decreased ability to think or concentrate, thinking about planning or attempting suicide. To determine if you have bipolar disorder, your evaluation may include physical exam, psychiatric assessment, mood charting, criteria for bipolar disorder. When it comes to the cause of bipolar disorder, science studies came out as genetic, but many still believe that it is a mixture of both genes and environment. According to WebMD, environment triggers bipolar episode. Sleep habits is one. Sensory overload, when there is too much noise or lights, crowds, traffic, lots of deadlines, too much caffeine or nicotine can set up for bipolar episode. Stress is also a big factor. The strained relationships, finances, work or no work, and loss of a loved one can make the mood symptoms worse. Lots of excitement can be a form of stress and overstimulation. It can push someone with bipolar disorder beyond happy or proud into mania. Other triggers include disruption of routine, fights with family or friends, skipping medicine, drugs, and alcohol, a new baby, switching time zones, and temperature. Treatment is best guided by a medical doctor who specializes in diagnosing and treating mental conditions, who is skilled in treating bipolar and related disorders. You may have a treatment team that also includes a psychologist, social worker, and psychiatric nurse. Bipolar disorder is a lifelong condition. Treatment is directed at managing symptoms depending on your needs. Treatment may include medication, continued treatment, day treatment programs, substance abuse treatment, and hospitalization. The primary treatment for bipolar disorder also include medications and psychological counseling to control symptoms, and also may include education and support groups. Taking psychology course has definitely affected my views regarding mental illness. Prior to taking the course, I have a very limited knowledge and understanding about what people with psychological disorder go through. I realized that some people I already encountered may have shown signs of psychological disorder, but a lot of us don't have a clue and ending up judging them. Dealing with somebody who is suffering from psychological disorder takes a lot of patience and understanding. It is important to recognize their symptoms in order for us to be more alert and helpful in case they suddenly have an episode. I will definitely use the information I learned throughout this course in my everyday life. Since I chose to be in the healthcare field, my goal is to learn more and excel in every level. Thank you for watching.